My name is Nuria. Some of you may already know me because I have been working in CTI for 4 years now as a CRA in Spain. Like many of you, I spend my days working and supporting clinical trials. And we all know how complex this work can be, but also how truly meaningful it is. For years, rare diseases were just part of my professional environment. However, that sadly changed when my wonderful niece Ines was diagnosed with an ultra-rare disease called BPAN. Suddenly, rare diseases weren't just part of my job, and they became part of my family story, and they became personal. I am very grateful to work in a company like CTI that supports these underserved patients, and knowing that our work can bring hope to families like mine, that really motivates me to keep going. With that, I would like to introduce my brother-in-law. I am the father of my niece, Ines.
Well, first of all, thank you all for listening to us. I am Enrique, this is Ines, and our story begins when Ines was 1 year old. The first year of Ines was basically as any other child, full of new experiences, full of discoveries. But when she was 1 year old, she started to have some seizures. Just explain to them different sort of seizures, fever seizures, epileptic seizures, monoclonic, or a different set of events that make us to suspect that there was something different happening. Not only epilepsy, but something behind it. So the neurologist started to study everything in detail, and a few months later, in March 2025, the result was conclusive. Ines had BPAN, and it was diagnosed as a result of a genetic panel of different genes analyzed. So after receiving the diagnosis, the first question is, what is BPAN? Well, BPAN stands for the words in English, beta propeller protein associated neurodegeneration. So it's an extremely rare disease with a prevalence of 1 person every million. So that gives us an estimation of around 500 to, in the luckiest situation, 2,000 people in the whole world with this disease. And the basic idea of this is that it involves excessive iron accumulation in deep regions of the brain. So this region, which is the basal ganglia, affects to a critical area that controls every movement in the body. As you can see, it is not able to talk properly, and it affects a whole set of neurological functions. So the origin of this disease is genetic. It is caused by a mutation of the WDR gene, which is linked or located to the X chromosome. So that's why most of the patients are girls. It doesn't mean that there are not boys, but usually when a boy is affected with this disease, with this mutation, they don't even get born because of the level or aggressiveness of the symptoms that they would have. So in terms of symptoms, in the childhood, it's everything related with recurrent seizures. Most of the cases are very difficult to handle with any medical drug that they can take. Most of the times they need to shift from one medication to another because it stops working eventually. They also have developmental delay, intellectual disability, cognitive and physical problems, motor control problems, etc. But these symptoms that vary from one individual to another depending on the case, because it's a case-by-case study what they have to do to better know BPAN. It progressively worsens. That means that when they get older, maybe the seizures disappear, but another set of symptoms, more severe, appear, like cognitive and physical deterioration, dementia, Parkinsonism, behavioral changes. They can even completely lose abilities like speaking, walking, or even swallowing. So all this lead us to a situation in which they may even die prematurely. So I've said there is no treatment for this, but it doesn't mean that there is no hope. So we have created BPAN Matters. BPAN Matters is a family charity that is fighting not only for Ines, it's fighting to get connected with different families, different countries, but also with physicians, researchers, experts in the field that can not only find a solution, but also let us know how to handle all the situations that we have to face in the meantime. That meaning that we also need guidance with the therapies. So with BPAN Matters, we are trying to get connected, everyone who has anything to say, but mostly families. We want to give a big role to families because from our experience, we think that we can have a great impact on the research. And in this research that we've done, let's say from a family point of view, we've found a project that is really, really encouraging. It's really promising, and it's being conducted right now at London. And it's been led by two great organizations. The first one being the Great Ormond Street Hospital, in collaboration with the University College London. They have a great expertise in BPAN. They've visited already over 200 patients of different ages, so they've learned a lot. And the goal they have is to develop a gene therapy that is going to be able to not only develop a right copy or a healthy copy of the gene, but also they're going to find a way to put the gene in the right place. So all the cells that are needed in this repairment will be able to do that. But of course, as in any rare disease, we're facing the basic problems: lack of research, infrastructure, lack of investment, and lack of resources. So that's why also from BPAN Matters, we are supporting this kind of research, trying to get as many of course, donations, but not only donations, but also engagement. You know, Ines wants to be, and she is a star of this video, of course, so that every single lady, every single baby girl as this, Ines, can get the treatment that they need, and that is going to actually save their life. So this is our story, and our idea, our will is to get it spread all around the world.